Greetings. My name is Dr. Marwan Abouljoud. I'm the director of the Henry Ford Transplant Institute. I want to thank you for putting your trust in us and the liver transplant team while you're going through your liver transplant evaluation. We also appreciate the family support and the family that's with you today. That's going to be your support as you go through this journey. Our team prides itself in the compassion and the message of hope and the kindness that's built around the program with which we deliver the care to yourself and the support to your family and other supports. Liver transplantation saves lives. In spite of all the innovation we've done and implemented and the ways we've tried to accept organs for those people who are waiting on the list, the demand outstrips the supply. The dire statistic is as follows. Anywhere between 1 in 4 and 1 in 5 people who are evaluated for a liver transplant and placed on the list do not make it to transplant. And the reason for that is nearly half of that number reflects patients who are removed from the list because they got too sick or they died while waiting. And that's very sad when we have the technology and the skills to deliver liver transplantation the way we have now. I would tell you that Henry Ford has invested significantly in developing the Living Donor Liver Transplant Program, which started in 2000. Over 20 years with the same team and excellent outcomes that exceed the averages. So why living donation? When you're thinking of living donation, think about this. If we take 100 people, place them on the waiting list for liver transplant, and another 100 put them on the pathway to living donation, a greater number of people after living donation are alive compared to those who are on the waiting list. And that's because we are not racing against the clock. We can time the transplant. We can do it at a time before you get critically ill. And also, the organ that we choose is highly selected from a healthy person without any complexities. Now, people ask, how do I get a living donor? Our team has put a champion program together, and you can look more information at henryfordlivingdonor.org for more details. But the question is about our living donors. Our living donors, the way we see them, we have an amazing degree of respect because they give such a selfless gift. And we also find them to be a unique set of people, and we call them our angels on earth. We care for them with compassion and truly a fair amount of love and support. And all our living donors that have gone through the living donation for over 20 years, when asked, would you do this again? They had a resounding yes, that they'll be willing to go through living donation again because of the experience that they had gone through, that both made them feel more connected to the recipients and a sense of doing good. Doing good is a big driver among our living donors, and we're so grateful for that selfless gift that they have shared with us. We always say the greatest gift deserves the greatest care, and we care for our living donors in a very unique way. Our living donor team, composed of surgeons and physicians and other healthcare professionals, are devoted to living donation, and they're separate from the recipient team. This is how important we view this. So I hope that as you go through the journey of your liver transplant evaluation, you know that the entire liver transplant team is behind you, whether you go for a deceased donor on the waiting list or opt for living donation. And we are there to support our living donors as well. Knowing what you know today and what we've shared on this video, if yourself, your family member, or an interested party would like to get more information on living donation, I would urge you to go to henryford.com/living donation. On this website, you will find information on how to pursue living donation or questions and answers and frequently asked questions, and a link to our coordinators and our team as well. I wish you the best of luck on your journey.